Hello everyone, today we are going to demonstrate how to perform CPR on small babies like a kids and infants we could say. We perform CPR on baby who is in cardiac arrest. So before starting our CPR we should follow certain steps. So like checking whether scene is safe or not. So if scene is not safe you have to take him to the safest place. Then second step is to check the response. Checking the response on baby is bit different from the adults. In case of adults, we tap on the shoulders and shout, but in case of small babies, we rub on the palms and sole and ear lobules. So that is how we are going to check the response. Then third step is you have to call for help, activating the emergency systems or activating the ambulance systems or activating the hospitals which are nearby. Then fourth step is again it is a crucial step to check the pulse and breathing simultaneously, which is suggested for medical personnels. If it is a non-medical personnels, we do not suggest, because these people will waste their valuable time on checking the pulse. So we do not suggest for the non-medical personnels. If you think that baby is not breathing, you think that baby is in cardiac arrest, and start the CPR. Then if you are alone, then how to do CPR? Then you can use your two fingers to give the chest compressions. So these are my two fingers. I am going to keep my two fingers on the baby's chest. Same thing, which is the line which joins both the nipples. This is the place where you are going to keep my two fingers and start the chest compressions. Then I have to secure baby's head without nodding. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Then two breathings. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. That is one technique. So there is another technique of doing CPR on babies. So that's called thumb-encircling technique. So you have to keep your both hands around the patient chest, then start giving the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I shall give two breathings. So like that we give CPR on babies.